February special. I'm Hairianto Diman. Now, the International Air Transport Association just concluded a briefing earlier on the impact of the COVID-19 outbreak on the aviation industry. Now, among the issues addressed include the extent of the impact brought about by the outbreak on airlines, the risks of being infected on a flight, and how one can keep safe during a flight. Now, to tell us more, we have IATA Chief Economist Pearce, as well as IATA Medical Advisor Dr. David Powell. Welcome. Now, Doctor, let's start with you first. Airlines are seeing increasing passenger dropout rates. Now, is it still safe to fly in this situation?
Yes, it's still safe to fly, and remains so. Really, the risk is no different from before the outbreak. We know that already in this outbreak, there's been a number of instances where people have flown, even while unwell, and they haven't transmitted it to others. The respiratory spread of this organism requires generally close contact, and actually most of these cases that we've seen have been from household contact and hospital type contact, rather than casual contact just sitting near somebody.
And Mr. Pearce, now on to you as well. You mentioned early on, of course, there is a projected forecast of a drop in terms of travellers numbers, and initial reports also suggest that airlines in Asia would be the most badly affected. But now, as the outbreak spreads globally, the entire aviation industry has been affected. How bad is the impact or the extent of this impact?
Well, it's not just the forecast. We're already seeing a dramatic drop in travel, not just in Asia, but in Europe, as the COVID-19 outbreak spreads. We're seeing probably a loss of about 13% in travel in Asia. That's revenues lost of about 28 billion. It could be double that as a result of the spread outside. We could see, under a scenario where we see an extensive spread, the industry could be facing lost revenues in excess of $100 billion this year.
And, Dr. Powell, many are concerned about the air quality in a confined space, for example, like an aircraft. Should passengers be worried about the air quality in an aircraft when they are traveling?
Well, on that score, I can be very reassuring. So the air supply to a modern jet airliner is refreshed at about 10 times the rate of a typical air-conditioned building. Half of it's fresh, the other half is recycled through the same sort of filters that we use in surgical operating theatres. So what's coming through the air supply is very pure, and it's certainly not going to be carrying COVID-19, because that's not really an airborne virus. In fact, these filters filter more than 99.97% of all viruses and bacteria. So any risks that's there is from contact with those close to you, and the solution to that, actually, surprisingly, is about hand hygiene, because you don't want to be touching somebody else that's touched any surface recently, having coughed into their hand.
And I think this is something that has been reiterated over and over again, the idea of hand hygiene, practicing good hand hygiene, yeah? And, Mr. Pearce, you mentioned and you did a comparison to the Sars outbreak as well. If you could tell us, how does this situation compare to the 2003 Sars outbreak?
It's considerably worse. The SARS outbreak was in many ways a regional disease outbreak. China is much bigger and much more significant today. And of course, we've seen the COVID-19 outbreak move to the global level. So it's much worse than the SARS episode. I think the revenue shock, is potentially comparable to the global financial crisis.
And, just as a roundup of our discussion today, Dr. Powell, if you could share with us and our viewers who are watching us right now, what are some of these steps that one can take to keep one safe during a flight? Well,
first, don't travel if you're unwell yourself. And second, hand hygiene. You can follow the WHO advice, actually. If you cough or sneeze, do that onto your sleeve or into a tissue, and then wash your hands or sanitize them. Do so frequently, and try to learn not to touch your face. Try to learn not to touch other people, and think of a new greeting other than a handshake, bump elbows or something like that, because it's touch that's a very important mode of spread.
Well, thank you so much, Dr. Powell and Mr. Pearce. That was IATA Chief Economist, Mr. Pearce, as well as IATA Medical Advisor, Dr. Powell, who shared with us on the economic impact of the coronavirus outbreak on the aviation industry and how one can keep safe during a flight. Now, you can also read more on this in the papers tomorrow or on our website, straitstimes.com. Once again, I'm Hairianto Diman, reporting for the Straits Times.